Okay, so now we're looking at that lateral compartment. Once again, another compartment that's often missed. So we're predominantly looking at that's perineal muscles, or for those therapists that are in certain countries that call it the fibularis. Obviously here in Australia we call it the peroneals. So we've got three muscles, obviously longus, we've got the brevis, and then obviously tertius just in here as well. Once again, I've got Monica just off the table here so I can introduce some passive release techniques, and this time we're going to work along basically the length of this lateral compartment. So keep in mind that we do have the fibula bone right underneath, hence the reason they call it fibularis. Okay, so once again I'm going to come underneath the foot here, so that way I'll be able to control how much range of movement I come here. I'm still going to use a really loose fist for this. Make sure that you're not pushing down into the tibia, the fibula, okay? More so that you're going to glide along the muscle itself, okay? And then introduce the range of movement that way, okay? Make sure they're supported as well under the knee here. You could also have another towel under here if you wanted to, but this should be suffice enough. So we've got a contact area here and a contact area there. And once again, as I said, bring it foot up towards you, okay? So evert, if we want to get technical, okay? And then the whole idea is that we're going to go into inversion, okay? So once again, I'm gliding along. Now think of doing this technique that you are pushing toothpaste out of a toothpaste tube, okay, as you're gliding along. So not pushing into it, but along it, okay? Right along the length, okay, all the way up, okay? Once again, evert, okay, along, okay, just pushing all that tissue up. You're squeezing the toothpaste out of the tube along the range of movement at the same time, all the way up, just short of head of the fibula. So if you go up too high, you're going to hit that fibula head there. Not ideal. I'm not a big fan of the bone massage, as I said before, so try and avoid that. So avert, all the way up, or right along the length of the muscle. Okay, all the way. So once again, see the speed I'm going. With all these techniques, you'll notice I don't rush through them. Just feel for the tissue and work through it purposefully. That's the key. Anyone can rush through the tissue and push hard. Not necessarily means that you're going to get the effect that you want. So listen and feel through the tissue itself. All the way along and up. Beautiful. Lateral compartment, all right? So right along that. So we're going to engage the tissue just above that lateral malleolus along, and you can divide your strokes a little bit either to the back towards that gastrocoileus or even to the front towards that extensor digitorum longus as well.
So if you even remotely enjoyed some of that content, please do me a favour and hit the like button below, just so that I know that you did enjoy it. Also, if you don't want to miss out on any of the content that we put up on a regular basis, then the best way to do that is obviously just to hit the subscribe button. So it's a bit of a no-brainer. But most importantly, if you really want to see the true show, the real show, take the opportunity, hit the link below, stuarthinds.com. That's where we have all the comprehensive assessment, treatment of a whole range of conditions. That's where we have our online courses and obviously our mentoring and so forth, the webinars and our podcasts. So if you're even remotely interested in what we do, go and check it out. Appreciate it. But also, most importantly, again, just be awesome at what you do.